So overall, we know that cancer costs are rising for our patients. So they're rising for society in general, but specifically more and more of that burden is being pushed onto the patient. It's being pushed on in terms of co-pays or co-insurance, and it's really decreasing the quality of life and sometimes the quality of care for our patients. In our study looking at how the burden may potentially change over time was based on prior research that showed that cancer treatment costs had a U shape, meaning that they were the highest at the diagnosis and that they were also high at end of life, and then they may have dipped in the middle. So we were really interested in looking at how costs may change over time for our patients. And we assessed it via a longitudinal study that assessed, 2 time points essentially of people who were on active treatment for cancer and then followed them and resurveyed them 3 months later to see if that there was any additional changes over the time course, and then overall in kind of the big picture for those patients, how long they were on treatment, and if, for example, the length of treatment they were on. Some people had well-controlled metastatic disease. They had been on treatment for years and years. Some people were really in that kind of new diagnosis period where they had been on treatment for maybe 3 months, to see if there was a correlation in financial toxicity to the length that they had been on treatment. And interestingly, contradicting potentially prior research, we did not actually find a real change in terms of their financial toxicity related to the length on treatment. But what we did find is that overall there was a significant portion of people who were having financial toxicity, meaning were having negative quality of life outcomes related to their cost. And that itself, of course, is something that we need to be focusing more and more of our efforts on, because again, these costs are rising and they're really negatively impacting our patients.